Hello, everybody. Welcome to the Flourish podcast with Dr. Toni Engram, where you will hear straight from some of the best practitioners and leaders in wellness on how to take control of your family's physical, spiritual, and mental health, because we are all designed to flourish. As a reminder, this show is for educational and entertainment purposes only. Nothing said on the Flourish podcast should be taken as medical advice. For your own specific medical advice, please always consult with your own healthcare providers. On today's show, we have the lovely Dr. Engels. Dr. Jennifer Engels received her medical degree from the University of Texas Medical Branch in Galveston. She completed an internship in internal medicine at Dallas Presbyterian Hospital, followed by a residency in radiology at UT Southwestern in Dallas. Next came a one-year fellowship in women's imaging at UT Southwestern, and with this extensive training, she soon joined the staff at the prestigious Cooper Clinic, practicing diagnostic radiology. Dr. Engels became interested in functional medicine through a colleague after going through some twists and turns with her health. Her first step into this new area of medicine led her to a degree in nutrition and health coaching from the Institute of Integrative Nutrition in 2011. This inspired a 10-year journey and transition from conventional medicine to practicing functional medicine. Then in 2021, she completed her degree in functional medicine from the Institute of Functional Medicine and became a certified functional medicine doctor. She holds advanced training in hormones, cardiometabolic health, immune health, gut health, environmental toxins, nutrition, and brain health. After spending most of her career as a radiologist, Dr. Engels opened WeCare Frisco in June of 2021. Within 12 months, her practice outgrew the space, and so she moved to a bigger office in Frisco, and her clinic focuses on addressing the challenges of aging during midlife. Common patient concerns include hormone imbalances, fatigue, weight gain, low libido, joint pain, poor sleep, brain fog, memory issues, low energy, thyroid problems, and osteoporosis. Her approach to healthcare is proactive and personalized, with an emphasis in precision medicine. I hope you guys enjoy the show. All right, everybody, welcome to Dr. Engels. We're so glad to have you, and I'm super excited to talk to you today.
Thank you. I'm so happy to be here.
Now, tell me a little bit. You've got this awesome background in radiology. Tell me a little bit more in depth about, I guess let's just start on how you got into medicine in the first place. Why medicine?
Well, that's a good question. My dad is a colon and rectal surgeon, and there's a lot of other doctors in my family, and I'm one of 4 kids, and my dad kind of selected me as being the one that's going to be the doctor. And it was a lot of pressure, and I kind of had to rebel a little bit, but then I came back around to it in college. And so I became pre-med a little late. And I've always been interested in health, fitness, wellness. Like I played college tennis. So I've always been interested in having the best performance, the best food, everything. And I went on to medical school, and that's where I met my husband. And then I went into radiology, and I did a fellowship in women's imaging because I was really more interested in breast cancer prevention and biopsies and that kind of thing. So I did an extra year learning about women's health and all the imaging that goes along with that.
Awesome. Very
Yeah.
cool. Very
Yeah.
cool. So where are you in birth order? Are you the oldest?
No, I'm 3 out of 4, but
That explains the rebelliousness.
yes, the first 2 kids have a different father. So I'm kind of the oldest child between me and my younger brother, and then I'm a middle child in the 4. So it's kind of a blended situation.
Oh, very cool. Very cool. Okay, and then so you had maybe a slight rebellious streak. You've always been health conscious. What drew you then to functional medicine?
Well, my last radiology job was at the Cooper Clinic in Dallas, which is kind of a preventive medicine mecca type place where people get executive physicals and all that. And I was in charge of women's imaging there. And while I was there, I got exposed to nutrition, cardiovascular health. I got to get my own Cooper Clinic physical every year. And I just decided I was really more interested in the preventive side rather than waiting till it shows up on the film. It's kind of a little late. So, and I would have healthy women get breast cancer, and they'd always ask me, well, what did I do wrong? Why is this happening? And I couldn't really answer them at that time. So I felt like I need to learn more. And I started to do integrative nutrition, IIN. I did that online program, and one of the speakers was Betty Murray, who's a local functional medicine doctor. And that was the first time I had ever heard the word functional medicine. And I was so blown away by her lecture that I tracked her down. I went to her clinic, and she spent an hour with me explaining it to me and telling me how I can learn more. So I started going to the functional medicine weekend trainings starting in 2012. And after a few of them, I was wondering, like, how can I do this? Like, I'm a radiologist, but how can I do this for people? So I was first doing it for myself because I had my own gut issues. I had hormone issues. I went into early menopause, and regular doctors were kind of blowing me off and telling me, oh, no, you're too young. You're too young. And I was like, no, there's definitely something wrong with me. And I finally found a doctor who was willing to check my hormones. And he told me, oh, no, you're in full blown menopause at age 43.
Oh my
And
gosh.
so I had to get on hormones at a younger age, but it changed my life because those few years leading up to that, I was depressed. I had insomnia. I thought there was something wrong with me. Antidepressants weren't working. Like, I was told I had resistant major depression. And I was like, this is crazy. And once I got on hormones, it lifted me out of that. And then I was able to get off of antidepressants. So I just decided that's what I want to help people, because I feel like a lot of doctors don't have that much training in hormones. There's a lot of misconceptions and a lot of fear around hormones that's unfounded. And I feel like it's kind of my journey to help women and try to prevent them from suffering the way I did.
Absolutely. Absolutely.
Yeah.
So was it a functional medicine doctor that finally helped see what was going
Yes.
on?
Yes. Uh-huh. And they also helped me with my gut. I had issues. I had a colonoscopy, and that was negative. They really didn't have much to offer. I was having bloating every day, right around the same time every day, like clockwork. And I knew there had to be something in my diet or something. So I went to Betty Murray at Living Well, and she checked my gut and my food sensitivity. And I was highly sensitive to gluten. And I don't have celiac, but I'm highly sensitive. So I've been off of gluten for 12 years, and it's totally reversed my gut issues. So she helped me with SIBO. I had small intestinal bacterial overgrowth. I had yeast overgrowth, and I had all these food sensitivities. So she helped me unpack that and put me on a paleo diet and, really clean everything up. And now it feels great. So
That's
that
amazing.
started my journey.
Amazing. And
Yeah.
I'm in a mastermind with Betty Murray. So once we edit this and pull clips, I'm gonna have to. I'll share with her because I bet she'll be so excited to hear that.
Yeah, she really helped me get started. I worked at her office for about a year in 2014. She helped me back when I was doing the training, and I still didn't have my certification yet, but she let me rent a room at her office.
Very cool. Very cool. So fast forward several years down the road, you decided to open your own practice. And I'm guessing by 2014-ish, had you moved away from radiology altogether, or were you still doing?
Yes. Well, I kind of stepped down from radiology when my kids were about 7 and 10 because I had nanny issues and things, and I was kind of getting burned out on that, and that wasn't my passion anymore. So I decided to stay home with my kids for a few years and continue my education with the modules through IFM. And once they were kind of more independent and on their own, then I decided to open my own clinic. So I had a few years at home with them, which was great.
Ah, oh, that's awesome. How old are they now?
21 and 23.
Oh, that's awesome. Very
Yeah,
cool. Very
yeah.
cool. I'm not quite there yet. Mine are 11 and 15, but I feel like I feel like it's tomorrow and they'll be 21 and
Yeah,
25. It'll be here
right.
before I know it.
Yeah.
So, so you decide you're away from radiology and all into functional medicine. You get your IFM certification and you decided, okay, I'm ready to get back to it. I'm guessing kids are older by this point. You're ready to get back
Yes.
into it and you open WeCare, right? Is that
Yes.
that's the name
Yes.
when your practice started in Frisco?
Yes. WeCare Frisco. Yes.
Awesome.
And it was kind of funny. I had all this education, but I didn't know how I was going to do this. And I had gone to my acupuncture doctor friend, and that night after my visit, she called me and said, "Would you want to rent a room at my acupuncture office so you can start your practice?" And I was like, "Well, yes, that would be great," because I couldn't just start from scratch. So
Yeah.
she has a very busy acupuncture practice in Frisco. She has thousands of patients, and she let me use one little room. And that got me started. And she started sending me a few of her patients and helped me just kind of get off the ground. And I was there for about a year and a half. And then I kind of grew out of my space, like I needed more room. So that's when I moved into my own office in Frisco.
Very cool. Very cool. And where about in Frisco are you?
Um, Ohio and Lebanon area, so just east of Preston.
Huh?
Yeah.
Very cool. Very cool. And who would you say, I mean, it sounds like I know you've got a passion for women's health. You had your own crazy experience getting to learn kind of where more quote unquote normal or mainstream medicine just isn't really all that effective for chronic issues. But tell me kind of who your patients are primarily.
Well, they're kind of like me. I mean, it's really perimenopause, menopausal women. I do see men, but it's my practice is about 90% women. And then sometimes they'll bring their husband in after they've been with me a while, they'll convince their husband to come. But I only have a few men that come to me. It's mainly women.
Piece.
So, yeah.
I thought my practice was female heavy. Yours is really, really female heavy. I love it.
Yeah. Yes.
And favorite conditions, I'm guessing perimenopause,
Yes.
menopause.
Hormones, hormonal balance, gut issues, weight. A lot of women come to me with weight loss resistance, fatigue, insomnia, adrenal fatigue. Um, so it's all connected, really. Like once I can get their hormones balanced, they'll have more energy to exercise and make better choices and all of that.
Do you do a lot of bioidentical hormones for your patients?
Yes, so that's all I do. Some women don't want to do that, and I can do herbs as well, but I don't use any synthetic. I only use bioidentical, and I work closely with compounding pharmacies in the area. So we tailor it to the patient based on their labs, and we come up with formulas for them, and we track it very closely with Dutch testing. Are you familiar with the Dutch? Yeah. So
Yeah.
once I get a woman on hormones, I like to do the Dutch test about 2 months later to see how well she's detoxing and metabolizing the hormones. I like to look at her cortisol levels over a 24-hour period to see how that's affecting her hormones. And it also gives me a look at like B vitamins and if she's deficient in those things. So it's a really good test to monitor if the hormones are at the right level and how well her body is detoxing them, because everyone's different genetically, how well they metabolize hormones.
Very cool. So what would you say are some of the biggest misconceptions about hormone issues for women?
Well, there's just a lot of fear, and I think it's unfounded. There was that women's health study that came out in the early 2000s that threw hormones under the bus and put the fear in everyone. But that was based on synthetic hormones, and it was really not a good study. And now data is coming out that it was really not a good study. And unfortunately, the media got a hold of it. And that's what women remember, is how scared everyone is. And a lot of doctors stopped prescribing it and they just took everyone off cold turkey. And that's the worst thing you can do. But the good news is there's been a lot of advances in the bioidentical hormones, which is completely different than what was in that study. And so what that means is compounded pharmacies can make very clean hormones that are almost identical to what your body would make. And so it's much safer, it's cleaner, and we can monitor it really closely to make sure the levels are correct. And I feel very comfortable doing it for women.
Do you have, which pharmacies are your favorite ones in the area?
My favorite is Allen Family Drug. They're actually pretty close to where you are. They're great about getting on the phone with me. I can talk to them whenever I call. Like, they're just very personable and knowledgeable about hormones. One of their pharmacists is A4M certified in hormones. So she's very knowledgeable, and I just think they do a great job, and my patients like them when they go pick up their stuff. So that's my number one. I also like Las Colinas Pharmacy, but they're a little further away. And then Drug Crafters would be my third. They're just harder to get on the phone. They're so busy that it's just a lot more of a hassle, the hassle factor.
Got it. That was a completely selfish question because I'm
Yeah.
looking.
Well, it's a shameless plug for Allen Family Drug.
Okay, noted.
Yes.
You know, you were talking about the study that kind of scared everybody from hormones back in the day. Have you seen the recent news stories about fasting and all the headlines based on this one? It wasn't even a study. It was like an abstract that they were presenting at a conference that hadn't even been published yet. It very similar. I don't know how you feel about fasting, if you use it in some of your.
I do. So I didn't hear that study. Was it saying bad things about fasting?
It was. It was saying, and the headline that got picked up was that intermittent fasting, this 16/8 intermittent fasting, was associated with like a 91% increase in cardiovascular death.
Oh, okay. I
It's
need to
pretty,
look that one up. Yeah,
pretty
that's pretty extreme.
inflammatory,
Yeah.
but it was horribly done. It was based on recall of like a 48-hour period or something ridiculous. It was once you look at it, you'll be able to dig in for about 5 seconds and see very similar headlines that any media outlet could grab and get tons of clicks and eyeballs on, but nothing really that had any valid science behind it at all.
Right. It's a shame that that happens, because I do think intermittent fasting is a very powerful tool for the right people. I don't use it in women that are, their number one complaint is fatigue, because I need to get their adrenals working first before stressing them with fasting. So there's a time and a place for fasting. And men do really well with fasting. They lose weight really quickly. Women, it's a little harder, but men, if they can do that 16/8 and quit drinking, they'll drop 30 pounds like overnight. I mean, it's ridiculous.
Fair, yeah.
It's not fair. It's not fair.
And so the women who do well with fasting, does it seem to be age related or hormone related where they are in their cycle, or is it all just adrenal function?
Well, so I don't know if you've ever heard of Mindy Peltz, her book, Fast Like a Girl. She has a podcast, and I've learned from her that women that are cycling, you really shouldn't fast that week before your period, because that's when you need more nutrients. That's when you have more cravings, because your body is probably low in magnesium, and that's why you're craving chocolate and having headaches and all of that. So that is not a good time for a woman to fast. But once they get through their cycle, right after it would be a good time. And they can do the 16-8 for a few weeks, but then once it gets closer to the period, like stop and eat, more consistently, 3 meals a day, that kind of thing. And then once you're in menopause, you're not as sensitive. But I just want to make sure that they're not, if they give me the history that when they work out, it wears them out and they have no energy left for the day, then that's kind of a sign that they don't have a lot of reserve, and fasting would not be good for them. That their body's going to think that's stress, and it could raise their cortisol and start storing everything they eat as fat. So for those women, I work on their adrenals I watch their blood sugar. I do a lot of continuous glucose monitoring with, an app. So I want to track, are they stable? What's going on? And then I encourage them to eat more small meals, like multiple meals a day, until we get them back stronger. And then they could start stressing themselves with fasting. But it just really, it's on a case by case basis.
You mentioned the continuous glucose monitors, and I've been seeing all the biohacker people, everybody is wearing those now. I love the idea of it for anybody, not just diabetics, but real life question. I haven't done it yet because I'm scared it's going to hurt. Does it hurt to stick that thing on?
No, it feels like a little pinch, and then it's on for 2 weeks. And so it's a one and done. It doesn't hurt as much as getting a shot or anything like that. So yeah, you
I
could have one of
realize,
your staff do it and just punch it on you and you're done.
fabulous. That
Yeah.
sounds doable. Do you still
Yeah.
need a prescription for it?
Yes. And I use a platform called Thea Health. It's THEIA health.ai or something like that. And they use AI technology to interpret your readings, because I mean, you can get just a plain continuous glucose monitor, but you don't get that much value out of it if you don't understand how to interpret it. So this app it's a good platform because the patient signs up for it, and once they're on the app, they can go in and order their continuous glucose monitors. It gives them a standing doctor's prescription for 12 months. So I just have to set them up on it, and once they're on it, they can order it whenever they want. They don't need to call me for a prescription. And
Nice.
then they download the app, and the way to get the most out of it is you can take a picture of your food, and then it'll track what your blood sugar does after that meal, for the next 2 or 3 hours. And you do that all day long. You also track your exercise. You track if you had insomnia that night. You track if you're feeling stressed or irritable. The more data you give it, the more you'll get back. And then it'll give you a report card at the end of the day showing you which meals you did the best with, which ones did not do well, how you did with exercise, how you did with sleep, all of that. And they can share their data with me directly, real time. So I will review it before their appointment, and then I can give them strategies. Like if I see a pattern, I can help correct that. Because it's normal for your blood sugar to go up about 10 to 20 points after a meal. But when I see it going up like 50 to 80 points and then crashing really low, then that's going to cause anxiety. It's going to make you feel terrible. You'll have more cravings. It's hard to lose weight because you're not going to make good choices. So it's really helpful in people trying to lose weight, because we learn how their food is affecting them. And then we can teach them how to make better choices to get more protein, healthy fat, less simple carbs, all of that.
Do you feel like from a macro standpoint that women tend to eat, is it too many carbs, not enough protein, too much fat? What are some of the mistakes that we commonly make?
Well, I do an in-body scan on everyone and I can calculate their hydration. And I would say at least 40% of my patients are very dehydrated. So that's easy. That's an easy fix, but they're starting out dehydrated. And then I think they don't eat enough protein. It's hard to get enough protein, and not enough vegetables like greens. I mean, we all struggle getting enough servings of vegetables. So I always tell people, try to fill half your plate with the vegetables and then have 4 ounces of some kind of lean protein and then a complex carb or something like that. And if you eat like that, you'll do pretty well. But a
You want
lot
to
of
know
people
something
don't do.
really cool? Is that
Yeah.
that is exactly what I tell my patients.
Yes.
Fill their plate with,
Yeah.
half with veggies that don't have a ton of sugar,
Yeah.
um, a fourth with lean protein, a complex carb, then cover it all with some kind of healthy fat to add some flavor.
Yes. Yeah. Yeah.
You're on the same page. I love it.
Yes.
So that's good. They'll manage their blood sugar and they'll have fewer cavities too, which is good.
Yes. Yes.
Okay, let's see. So, we've talked hormones, we've talked blood sugar. I love the GCMs. What are some trending areas of functional medicine that you're excited about?
Well, I just got back from a conference and I'm kind of a conference junkie. I love learning all the cutting edge new tests in functional medicine. There's so much coming out right now that it's hard to keep up. There's a lot of genetic testing, there's a lot of ways to test for toxins. We can even test how the toxins are mutating your DNA. So there's a new lab or I don't know if they're new, but they're new to me. They're from Germany and they can test your DNA and see if there's a toxin in there that's unraveling your DNA. So it's more of a functional genomics. So, we all know we have our genes, but this is telling you how your environment is actually impacting your genes. And if you see a certain toxin, then we can work on detoxing that and trying to find where's that coming from. Is it something you're putting on your body or eating or pesticides or mold or whatever it is? But if it's impacting your DNA, then it definitely needs to be addressed. So I've just learned about this test and I'm planning on doing it on myself. I always do the test on myself first before doing it on patients because I have to learn, how do I interpret it? Is it a value? Do I think this will help people? And if I think it is, which I do think it will be valuable, then I will start offering it to my patients.
Very cool. Very cool. Okay, so that's coming down the pike. I like it.
Yes.
Let's see. So you and I have talked separately about the mouth and our gut microbiome and how they're connected. How are you testing your patient's microbiome and what are you doing with that information in regards to their treatment?
So it kind of depends on their symptoms. If someone comes in saying they get bloated right after they eat and they're having a lot of either constipation or diarrhea or going back and forth, then that sounds like SIBO, which is small intestinal bacterial overgrowth. And I might do a breath test for that. And that's where they drink a little bit of this liquid called lactulose, and then they blow into balloons every 20 minutes for about 3 hours, and they ship those bags of air back to the lab, and then the lab tests for gases. And if you have SIBO, then you have some kind of abnormal bacterial overgrowth that's producing too much of one of the gases. And once I see the type of gas, I can target that and try to get rid of it. Oh, sorry. With herbs or pharmaceuticals, depending on how bad it is and what the patient's preference is. Some people don't want pharmaceuticals, so I try to go with just herbs. But then the other test I do a lot is the GI map, which is a stool test. So if their symptoms seem to be more lower, like more in the colon, And sometimes I do both because I can't tell from their history if it's higher up in the small intestine or lower down. So I just do both if they can afford it, because it gives me a lot more information. And the GI map shows what's in their microbiome, what good bacteria, bad bacteria, do they have yeast overgrowth, how well are they absorbing and digesting their nutrients, how inflamed is their gut, are they reacting to gluten? There's a marker on there that goes high if someone's eating gluten and reacting. It looks at inflammation markers, it looks at their immune system markers. So it gives me a lot of functional information as well as what's actually living in there, if they have parasites or whatever. So then I can create a whole gut healing protocol based on all of that information.
When you're treating folks with SIBO, is it still considered standard to go through a bout of some really strong antibiotics first? Or are there other ways?
Well, there's different theories out there. How I was originally trained is you want to get rid of, if there's an obvious, very high overgrowth of something, then we probably need to knock it down with anti-herbals or a pharmaceutical like rifaximin, which that one is a good one because it doesn't kill all of the good bacteria. It just takes care of the one that's overgrown. So the only downside to that is it's very expensive and insurance doesn't always pay for it. So it's very, very expensive, unfortunately. So it's not always an option. There's ways to try to improve the gut with diet, like a low FODMAP diet. But if they're really, really overgrown, it's hard to really knock it down too much with that. And then other schools of thought say try to crowd out the bad bacteria with probiotics. But sometimes when you have SIBO, if we try to give probiotics, it just makes the bloating worse. So I kind of have to see how sensitive they are and how bad their overgrowth is. And I may have to start them on the killing protocol first. And then phase 2 would be more of the rebuilding and balancing the microbiome. So I usually have to do it in stages over several months.
That makes sense. It's kind of similar to our protocols for oral health too, because sometimes if there's this huge imbalance, then we need to go through similarly a killing phase. Usually I don't need to do it with antibiotics. I'm doing it with rinses. But still, sometimes you gotta knock stuff down first and then reseed with the good stuff.
Mm-hmm.
And what's interesting is I actually experienced that myself, because the first time I did that bristle saliva test, I was pretty far out of balance. Before I got the results back, I just wanted to try this probiotic. And so I was doing too much, because that's what I do. I overdo things. I'm an overachiever. And doing the probiotic was like too much. Like my gums were more sensitive. I started having gut issues that I wasn't having before. So I think I just did too much too fast without without taking my time to be a little more strategic and rebalance things first.
Yeah.
Interesting. Well, what do you see? I know a lot of what I treat, and so a lot of what you treat also, is inflammation. Inflammation is such an amazing ability that we have when we need to heal from something that is broken or cut or injured. But how do you see inflammation in regards to the chronic illnesses that we face?
Well, I definitely think it's a main driver of chronic illness. So the key is trying to find the trigger, like where is it coming from? Is it in the gut, like some kind of bacterial overgrowth? Is it, things that they're eating, a very inflammatory diet, the standard American diet, or they could even be eating healthy foods, but their body's reacting. Like, for example, I react really strongly to eggs. And unfortunately, I love eggs, but every time I do a food sensitivity test on myself, I'm off the chart with eggs. So that's probably something I just can't have because it's very inflammatory to me. And other people, it's other things. And sometimes we have to do some testing to figure out what that is. And then if I still can't figure it out, I want to ask about the mouth. And I always ask about the mouth early, like in my first appointment, because I'm like, do you have bleeding gums? Have you been to the dentist? And if they're like, no, I don't really go. And every time I floss, it bleeds. So I just don't. And I'm like, okay, well, that could be where your inflammation's coming from. So I need to send you to the dentist and let them evaluate that while we work on everything else. Because if that's going on, then I can't really get rid of the inflammation because they're swallowing it, right?
Right. Yeah,
Yeah.
absolutely. Absolutely. And then that inflammation becomes systemic. Those inflammatory markers, they're throughout the entire circulatory system, wreaking havoc in all kinds of ways. And I still think, like, as much as we've improved our knowledge or expanded our knowledge in oral health in regards to inflammation and other inflammatory conditions like cardiovascular disease, I still think we're just scratching the surface on how intertwined it all is.
Right.
Because you
Yeah.
just
People
like that.
always, yeah. When I ask them about their dental health, they always look at me like, why are you asking me this? And I'm just like, well, it's very important. And your inflammatory marker is very high. So I'm trying to figure out where's the source. And this is an obvious source. So we got to address it. So I
I
think
get
there's a
those
lot of denial and lack of awareness.
for sure, because I get those same crazy looks when I talk to non-functional medicine trained physicians
Yeah.
about anything oral health related. They're like, so you're very ahead of the curve, just so you know. Okay, well, I think that this was awesome. I think what you do is awesome. And I'm so glad that you are close to us and we get to share patients and help folks get well together. So I'm super, super thankful for you. Do you have any words of wisdom for our audience? Any parting messages, things that you just want our listeners to know?
Well, I just want women that are out there suffering with their hormones and imbalances that they feel like they're crazy and they're losing their mind, and their regular doctors just want to put them on Zoloft or Prozac and give them some Ambien, that there's hope for them. Like we can help those people. And it's very rewarding to me when I have a patient come in like that, that I can find their imbalances, give them some bioidentical hormones or whatever they need, nutrients, replenish their nutrition and all of that. And then a few months later, they tell me they feel like themselves again. So there's hope, like you're not crazy. And I think there's a lot of gaslighting out there. And it's just lack of awareness that hormones are not evil. They're actually very helpful. So.
Totally agree.
Mhm.
Well, Dr. Engels, thank you so much. This was super fun. I'm glad we got to chat today.
Yes. Thank you.
And tell everybody where they can find you. What's the best way to reach you?
So my website is wecarefrisco.com, and I'm offering 15% off anyone that mentions this podcast. And you can go to my website and schedule a free discovery call. And in that, you can write a note saying you heard about me on Dr. Engram's podcast, and we'll give you a 15% off on the first visit, which is the foundational assessment.
Oh,
And
that's fantastic.
yes. And one other thing, I'm going to be doing an experiment on myself with the bristle health and the GI map. And I'm planning on doing them around the same day so that I can see how my oral bacteria, my gut bacteria, if they line up or whatever. And then maybe we could talk about that another time.
Oh, that's going to be so fun. We should both do it.
Yes.
Let's both do it.
Well,
Oh, that'll be so fun. We can compare our spit and our poop together.
I think that would be a fascinating podcast.
It would. Okay, let's do it. We'll make it happen.
All right.
everybody. Thank you so much for joining us on the Flourish podcast, and we will see you next time.
Okay, thank you. Have a good day.